So Nicole, I'm sure you know, is the one who created Peepity. And they just had some updates. So I talked to her on Tuesday because I was having issues. I wanted to create a student account so you guys could see what you go through. And I know how to troubleshoot for you, but with the update, some coding link things were not working properly. So she's on vacation for the rest of the week. So we're not going to go over Peepity today. We're going to go over more of just the clinical paperwork. But when she gets back from vacation next week, she's going to start working on it so we can get you on Peepity ASAP. Let's share my screen. So yesterday I added you all, you may have noticed. I added you all to a clinical course titled Clinical Paperwork D. So this is where you're going to submit all of your paperwork that I need to send out to your hospital sites. I'll send announcements here regarding clinicals, updates, reminders, all that fun stuff. So I wanted to go over the clinical paperwork because right now, and I want to apologize, I'm not usually this far behind in grading. I got through about half of you guys this week. I'm working on getting 3 rotations sent out to clinicals within the next like 3 weeks. We start rotations again. So it's been crazy, and I've been having last minute hospital cancellations and another class. So I apologize. I don't like being behind in grading like this, and we'll get it done, I promise. So this is where all your clinical paperwork will be. So the requirement checklist. So this is for you if you like to print it out and then keep a copy. This is where everything you need is going to be in one spot. Make sure that you read the instructions for each different type of document, and they may vary from hospital to hospital. And we'll kind of get into that once we go through each thing that you need. So before your first rotation, this is everything that I'm going to need from you. So you can upload it to Blackboard, or you can check it off, or you can put the date that you completed it. So this is just for you to look at. And then after your first rotation, you will look at this to see where you're at, if you need to update boosters, if you need to have new titers pulled, if you need a health insurance card or a new drug test or tuberculosis test. So this is just for your reference. And then the required information that you will need to send, and what I need to see on each of these, and we'll go over them individually on Blackboard. So this is just so everything is all in one spot for you. Let me pull this down.
For the TB test, how often do we have to get that one done?
So if you have a PPD test or the skin test, you will need to do it every 12 months. If you go to Children's Hospital is a little bit different, and they're more picky with their paperwork and their testing. They will need 2 negative tests within 12 months if it's a PPD test. If you get the quantiferin test, it should be good for every 3 years. So if you do that one, you usually get it once. But again, if you go to Children's, they require 1 quantiferin test every 12 months. So if you didn't go to Children's the first rotation, but you go the second rotation, you would either have to get another quantiferin if it's been 12 months or longer, and you would definitely have to get a PPD test. So you would have 2 within the 12 months. Does that make sense? And I put that here so that you can just have a visual reminder.
Okay, yeah, I have one, but it'll be expired by the time we go to clinicals.
Yeah, so you would need a new one. And anytime, so it's not gonna, it might, like with that example, within your first rotation, if you have something and it expires during the middle of your rotation, or even if it's like 2 days before, expires 2 days before the end of your rotation while you're still at that hospital, you're still gonna have to, I have to submit that paperwork before, and they're gonna look at it and be like, oh, well, Kara's TB test expires right in the middle of rotation, so she's gonna have to get another one.
Do the clinical sites like have a preference on what TB test that they prefer, like the skin test or the blood draw?
They do not.
Okay,
Or
thank
at
you.
least I haven't heard one prefer one over the other yet.
Okay, thank you.
I see there's someone waiting in the waiting room to come in.
Oh, thank you. I don't know why it didn't show me. Let's look. Let me stop share real quick. Okay. Thank you.
My question is, how do we get our immunization record?
How do you get your immunization records? So with your immunization records, you can go to your primary doctor. Sometimes school districts will have them, or the county health department. So we'll get to immunizations if you can't get those records in just a minute, and we can do something else. Here we have our clinical practicum manual. So you'll want to read through this because this is what's going to tell you what I expect of you, what hospitals expect of you through PIMA, your requirements, which we are going over today, all the contact information, which I probably need to update my information in there. How practicum sites are assigned. So once you get PPD access, which hopefully will be in the next couple of weeks, and I can go over that with you guys. Hopefully Gina or Derek will let me hijack one of their classes for a little bit, and we can talk about that. It also talks about patient privacy and confidentiality, gives you definitions. We need to adhere to HIPAA and the Health Insurance Portability and Accountability Act. So it's privacy matters. You're responsible to be HIPAA compliant, and we'll get some HIPAA training before you guys go out there. Clinical behavior guidelines goes over how you need to act at clinicals. When you're out at clinicals, you are a visitor, you're a guest in that hospital, you're representing PIMA, you're representing yourself. I like to think of it as the longest job interview of your life. Because if you're somewhere where you want to eventually work, they're not only looking at your skills, but how you interact with the other respiratory therapists and practitioners, how you conduct yourself with patients. So it's just basically saying, behave yourself, you're a guest in their house. Your student scope of practice. So this breaks down each rotation and what procedures you can perform with the supervision of another RT, and what you're expected to do regarding checkoffs. Unacceptable procedures. So if you are in RES 190, which is your floor rotation, you shouldn't be making vent changes or doing anything in critical care besides observing or things that you have been checked off on campus already for. Attendance and clinical hours, and then how we go about if you're going to be absent. If something, life happens, I understand that. So if you're going to be absent, how you would get a hold of me or Justin to let us know. You are required to have a certain amount of clinical hours, which is in here as well. So you want to make sure that you're going to have enough to pass the rotation. It talks about your attendance tracking, and then professional hours and their requirements. So how many are required. And the professional hours for your first rotation are not due until the end of that rotation. But that doesn't mean you can't start getting professional hours now, because they count towards attendance hours on your clinical rotation. So your first and second rotation, you need 20, and your last rotation, you only need 12. So you can start volunteering now. You can attend webinars. If we have guest speakers, those count for professional hours. And once you get onto PPD, you'll upload those all to PPD. Appearance and dress code is pretty much the same as school, except the biggest difference right now is tattoos. So no tattoos are allowed to be visible during your clinical rotations. They're allowed to be visible on campus, but when you go to the hospital, because every hospital is going to have different tattoo policies. Children's, you can have tattoo showing, but Good Samaritan will send you home if you have tattoo showing. So we have a blanket policy that no tattoos at any hospital. There's too many hospitals in the area to try and keep track of who's okay with it and who's not okay with it. Then we cover safety and what to do if you get hurt while you're at a site or you're exposed. The smoking policy, which is no smoking. That's not a good look for students in the respiratory department. Our drug and alcohol policy, so you will have to pass a drug and background check before clinicals. And then it goes over basic items that you might need at the hospital, how these rotations are graded, and then guidelines for social media. So you don't want to break a HIPAA law by posting patient specifics on social media. And we will go over this all in detail when we have our first clinical orientation. So this is something to read over because then you are, oh no, don't freeze computer. Because then you're going to sign at the very end, the last page is for you to say that you have read it and you'll sign it and initial all the lines saying that you accept the terms and conditions. If you're not following the rules, you risk going on probation or an academic warning, or risk being terminated from the program. So with all of these, so this is what you'll click to upload it, just like an assignment on Blackboard for one of your classes. And you upload it the same way. You're not being graded on this, so it says 1 point possible. That's just because I have to enter a point. And then in the grade book, you'll just see a check mark once I've looked over it to make sure that it's what I need. So this is how I would like you to upload your files. I tell you how to name them and save them. More so for the rest of what you'll be uploading, because when I send all this paperwork to the hospitals, it's easy for them to see, hey, this is Lucas's BLS card, this is the day it expires, and this is his full name. So I gave you examples so that they can just quickly see, okay, here's his BLS, here's his TB, here's his background check, here's his drug screen, here's his MMR, here's his TDAP, so that they can quickly reference it. And so I can quickly reference it as well. So your BLS card, you will get BLS on campus before your first rotation. So don't stress about trying to find a BLS class, or if you worked in the medical field previously, but yours is about to expire, don't worry about trying to find a new class. We will provide this to you and it's already paid for. So it's part of your tuition. And you will only need to do this once while you're in school because it's good for 2 years.
What if you already have your BLS?
It's part of class time, so you'll just get a new BLS card. So then you won't have to, you'll have another 2 years for that. Good question. So with your TB test, as we've learned, there's the 2 types of tests. We have the PPD and then the quantiferon. The PPD will be done every 12 months. So you'll need it for your first rotation and your third rotation. With that being said, if you go to Children's, either your first or second rotation, you'll need to have 2 negative PPD tests so that I can send them both to Children's Hospital.
How far apart do those need to be?
Children's will take them a week apart. So you'll have time, once you submit your clinical request, your site request, what hospitals you want to go to, and you see on PPD that I've assigned you to Children's, As soon as you see that you're on children's, you can go get that second test. So you don't have to worry about getting two before you know where you're going for your first rotation.
So we have to, if we
Cool,
go to
thank
children,
you.
you're saying
Oh.
we have to do like the blood test and the like skin test? Do we have to do both?
One or the other.
One or the other? Okay.
One or the other. Yep.
Okay.
So the quantiferin, so if you get the TB Gold test,
Okay.
the CDC recommends every 3 years. So if you, the first round, second round, you don't go to children's and then you go the third round, you'll need to get a second quantiferin test or 2 negative PPD tests in 12 months. They're
Okay.
super strict about that. And that just recently changed. So that's been fun with me dealing with. Good question. And then you'll upload it to Blackboard. So our background check and drug screen. So this is I have an example here of what it looks like. Maybe if it's going to pull up. So this is what it will look like. You guys can all see it, right? No? Okay. Let me see if I can share. Here we go. Okay. So this is what I need. So you'll order it through American Data Bank, which that website is on Blackboard. And this is just an example, so it's not accurate. But what I need to see is the criminal background check and the drug screen. So you would send this in. The document will probably be about 7 pages long because it'll have your entire history on it of addresses and workplaces, and then it has the drug screen on there as well. So it'll be longer than this, but this is what the document looks like.
Is this a different background check than what we went through to get accepted into the program? Or at least I had to go through background check prior to.
I think everyone goes through a background
Okay,
check.
so this is like separate, like an additional background check?
This is an additional. This
Okay.
one's going to, this is what the hospitals prefer. And it's through PIMA Complio. So you create a account with them and you have to pay for the drug screen and the background check. And you'll do this every 12 months. So you can order both at the same time, which is the standard package. Or if you are ordering one at a time, the drug screen has to be a 10-panel drug screen. And you have to go through PIMA. We won't accept drug screens from previous employers or from, if you go to like Quest Diagnostics or another entity, it has to be through this website here.
Okay, thank you.
So we don't and like right away because it's every 12 months.
Right. So, but you can start this now because your first rotation starts in, I just looked at it, in November.
Oh, I thought January.
Huh?
I thought we were January. I apologize.
No, you're good. You're good. November. So it's coming here pretty quick. So you want to upload it as a PDF. So PDF files are going to be what I prefer and what hospitals prefer. Sometimes you have to go through a third party to upload documents, and they only accept PDF files. So PDF files, when you order these, they will set you up with where to go for your drug screen. And sometimes the background check and drug screen can take weeks. So initiating it, you don't wait till the last minute and then be like, I can't get it in because I'm still waiting. A lot of hospitals want the paperwork at least 2 weeks prior to your first day. They have to get student badges made, or they need to go through HR and get you proper clearance. So the sooner you can do this, the better. Even if it's just focusing on one thing at a time. Hey, I know my goal for the next couple of weeks is to make sure all my immunizations are up to date and uploaded. So take it so you're not panicking at the last minute and adding more stress to yourself.
What is the cost of the drug test and background package?
I want to say it's $90. Don't quote me on that. I have to reach out to Justin about that.
Because hasn't been covered in our tuition, right? We pay out of pocket
Right,
for that.
you pay out of pocket for that. And then your flu shot must be done every flu season. So if your flu shot last year, you won't need to upload it because you are going out in the next flu season, which is 21-22. And that will be, Pima usually offers flu shot clinics. You can go to Walgreens, you can go to the Care Clinic in Walmart, wherever you need to go to get your flu shot, your physician's office. You just want to upload a copy as soon as you get it. And I do understand that the flu shot comes out later than what I want some of your required documents to be in before. So don't freak out if you don't meet the deadline for those.
Hey Stacy, for like the flu shot, what if you have an exemption?
Hospitals don't accept student exemptions.
Okay.
Good question. And you will need to get a flu shot every year while you are in school. So that's every year. Immunizations, we've talked about MMR. We've talked about the Tdap and micro, varicella and Hep B. So these are all the required immunizations. So the biggest thing that I am finding with immunizations is if they haven't been done in the last 10 years. So like when I went to school, I hadn't had the MMR since like middle school, and it's well over 10 years. So you have to have titers pulled. So that means you have to go to your physician or the health department or a clinic and have blood drawn to test for your immunity. So make sure if they're over 10 years old for MMR, varicella, and Hep B, that you have a titer that shows immunity. So we are proving to the hospital that you are immune to these infections, and it's not going to, you're not going to be at risk, and you're not putting your patients at risk.
If you like, do you have to do that, or can you just get boosters for these immunizations instead of doing?
If you don't want to do the titers, you can get boosters.
Okay.
If they tell you, because you're going to go and get boosters, sometimes the nurse giving you the MMR booster will say, well, you only need 2 in a lifetime. Well, if you're not doing titers, you have to have that MMR booster.
Okay.
Because we're in healthcare.
Okay.
If you're doing titers, make sure you give yourself plenty of time in case one comes back and says, well, measles and mumps show immunity, but the rubella shows no immunity. Then you'd have to get the rubella booster. And then you'd have to upload proof of that booster along with all the titers as well. Tdap is the only one you don't get a titer for. You would just get the booster for Tdap because it's not continued immunization. You have to get that every 10 years to obtain your immunity. Hep B is the only immunization that you can decline. If you don't want to get your titer pulled for Hep B, or your Hep B came up and titers showed no immunity, you could cite the Hep B waiver, but this is the only one that has a waiver. So when you upload this, you can either submit them one document at a time and name that file with which immunization it is, or if they're all in one document, you would just put immunizations and then your name. And the date of the test. Sorry, that needs to be right here. So date of the test, full name, and immunization. So if you don't know where your immunization record is, Lucas, you just want to get a titer.
Well, I've never had the chicken pox. I don't have chicken pox, like anything. So I have to get that. I know that for sure.
Start that now because the varicella immunizations are 6 months apart.
Okay, good to know. Yeah, also anyone that needs help, like if they don't have insurance, the Denver Health has a vaccine clinic and they'll do it on a sliding scale.
That's awesome. Thank you for that. There's also a clinic in Aurora. Where is it? I have it written down. Sleda. I have it in my resources section that I can put in here as well. So in resources, I'll try and put some links to other websites that you can visit. Your local health departments as well usually have pretty affordable immunizations if you need those. So Tri-County, Jefferson County, Denver Health is part of Denver County. So don't be afraid to check them out. You will need to go onto this website, My Clinical Exchange, because they are, every hospital is different on how they like their paperwork and how we process it. It'd be nice if everyone was exactly the same, but you need to register for an account on myclinicalexchange.com. It's a $39 one-time fee, and you won't have to pay that again through your schooling. But that is how, so what I do is you're approved through a hospital. So then I go to My Clinical Exchange, put in the request, and we'll say Swedish because they're one of them, Swedish. All the UC Health organizations except for University. A lot of the health ones, St. Joe's. So there's a lot of them that use the My Clinical Exchange. We'll go to Swedish. I approve your days. The hospital approves your days, and then I send all this paperwork that we've talked about. I upload it to this website, but I cannot upload any of your paperwork until your account is paid for. So you can register it, but if you don't pay for it, I'm not able to upload your paperwork. Okay, proof of health insurance. So University is the only location right now that requires proof of health insurance. So this can be private health insurance, or if you have Medicaid, Medicare, those are acceptable as well. Your COVID vaccine, so make sure you have, it's not required by all hospitals right now, but talking with Justin earlier this week, there are more hospitals who are requiring it, and Pima is probably going to require it as well. So if you have your COVID vaccine, upload it. Excuse me. If you haven't gotten it yet, make sure that you get it. Because going back up to our immunizations here, you can't get any other vaccines while you are in the process of getting vaccinated for COVID. So this can take time. So if you start sooner on getting your COVID vaccine, and then you start getting your titers and need boosters, the earlier you start, the better.
I assume COVID will now be a yearly thing, like a flu shot.
That's what they're thinking. But I haven't seen anything definite yet, but that's where it's headed, I believe. And then specific site paperwork. So you don't have to worry about this until I've assigned you to hospitals and gotten your schedules out to you. But on PPD, so we'll share here. This is an example. I'm working on Good Samaritan stuff right now. So Good Samaritan Hospital on PPD, what you do is you go to the clinical site link, and we'll go over this again since you're not on PPD. And then important documents. So these are paperwork that we would do here, and then you'd have to complete steps here. So you would go and do your COVID student agreement, fill it out, upload it as a PDF file, and submit it here. So don't worry about specific site paperwork until you have a clinical rotation assigned to you.
So real quick with that, if you haven't gotten your COVID vaccine, from what my employer told me, you're not allowed to get any immunizations within 3 months of your last COVID shot.
3 months. I heard 28 days. That's what I've heard.
Okay,
From
so
other
we've heard like
practitioners.
1.5 million different things.
Yes, of course. It's going to all be different. It's probably going to depend by provider, but I will look into that as well. 3 months, that's not good. But I do have the student who's getting their last COVID vaccine, and then it's 28 days after that Same with the tuberculosis test. They have to wait 28 days after that so they can do their TB test and have it read so you don't get a false positive. Okay, what other questions do you have for me? I know that's a lot of information, and there's a lot of steps.
So I had a TD booster 3 years ago. Is that like different than the Tdap booster?
Yes, because the
Okay.
TD would be tetanus and diphtheria, and the
Okay.
Tdap would
No
be pertussis.
Okay.
So talk to your provider about maybe just adding the pertussis vaccine to that, because then you'd have proof of all three.
The complete. Okay.
Yep. Any other questions?
So like all of this just basically needs to be done by, it said September 30th, right?
September 30th. I am
Just
going to,
Sooner than later, but by
Yeah.
the latest. Okay.
just because I want to give you enough time to, there's a lot of things that are out of pocket for you guys. I remember what it was like to be a student and struggling to be on a budget and then having to complete a drug test and a background check and immunizations and my clinical exchange fees. So I want to give you guys a heads up and enough time so that you can budget yourselves. So you're not rushing last minute and wondering how you're going to get everything done. And then we're giving the hospitals enough time to get everything in. I will double check your start dates and email that out to you guys for your first rotation.
You said that'll be in November.
November or December. Now
And-
second guessing myself. I have three. What the thing with our rotations and the way they're set up right now is all three rotations overlap each other at some point. So that's why, I mean, there's 25 of you, there's 28 in the class ahead of you. So trying to keep everything straight has been interesting. But I am working through it and I appreciate your guys' patience with me since this is a new role.
And how did these semesters work? Like, do the semesters count while we're in rotation as well?
Yep, that's a good
And-
question.
And
So
will we
you-
be in class doing classes still, or is it just strictly clinical?
Strictly clinical. So
Okay.
how Pima works, because the other RT schools are different in the Denver area. So how we work is you first and second semester are completely on campus. So you're in the classroom the entire time. You start your third semester at your first rotation. So the first day of your third semester, you'll come into campus once and we're going to have an orientation. So we're going to go over that the information in the manual. We'll practice clocking in and out on PPD. I'll tell you about all the requirements for the course, what assignments you will need to turn in, that type of stuff on your orientation day. And then you go out to the sites. There may be a lab day here or there. So that's just coming in and we talk about what you're doing out at clinicals, how you're emotionally handling it, what cool things you've seen, what support you need. Do you need help with the assignments in the clinical course? And then you go back out to your clinical sites. So, but those are scheduled into your clinical schedule. But you won't have any assigned classes besides your rotation. And then your second rotation is going to be in the end of fourth semester, well, the middle of fourth semester, and that's your IC rotation. So you come back from your floor rotation and you start having all your critical care classes at the end of third semester. So you have like emergency care and critical care techniques, and then you go on break. You come back for the beginning of fourth semester and you have intro to mechanical ventilation with Justin, and then you go on your IC rotation. You come back for the last classes. You get ACLS, and then you go out for your last NICU rotation. So it's kind of back and forth. Concord has classes like 3 days a week and then clinicals 3 days a week. So they're still in the classroom while they're on their rotations. Whereas you guys, are just on your rotations, and you don't have to worry about classes. You'll just have minimal assignments from me for your clinical rotation.
So as far as costs, we're looking at the drug test and background, the registration on the clinical exchange, and then our immunizations.
Yep, and then your immunizations. Yep. Good. Any other questions? And I will post an announcement after this Zoom meeting on that clinical. And have you been able to access the clinical D paperwork section? You see it on your Blackboard? Okay. So I will post an announcement on your start date and your end date on that first rotation, so you can have those in your calendar.
I have a question.
Yeah.
When do we like go over like what kind of hospital we're thinking of, and like is it like often that you get to go to that hospital?
So that's a great question. So we will go over that in detail. Let me pull up Peabody. And I know you guys don't have access to it yet. I was really hoping that I was going to be able to give you access. So we can look on Peabody. So when you get access to Peabody, we have a clinical site list. So if you live in Denver and you live near Swedish, or you have a friend who works at a hospital and you want to check it out, you can go to this list, like Denver Health, level 1 trauma. You know you want to do critical care, and it'll tell you a little bit about the hospital. It tells you what kind of equipment they have, how to get to the RT department. And then you have an area where you can request hospitals. There, it's being slow. So this is what the student portal will look like for you. And you can put in clinical requests. And there are some hospitals that don't take floor therapy students. So you need to make sure you're looking to make sure that you request a hospital with floor therapy. It's not coming up. It's being slow. But you'll put in your rotation, and then hospitals will pop up that accept that rotation. So children's, if you want to work with kids, Swedish, Medical Center of Aurora, Medical Center of the Rockies. So we have hospitals all the way from Cheyenne down to Grand Junction. So really you can go anywhere in the state. We could get you to Nebraska if you wanted to go to Sidney, Nebraska. So there are plenty of options for you guys. And once we get on Peabody, you'll be able to submit those. And what I tell everybody is I'm going to give the senior students their first choice. I'm going to look at them and their schedule, and then I'm going to go to the ICU students, and then I'll go to you guys. So I will do my best to try and keep you close to your home and give you what you want and need, but the seniors are going to get seniority. These are just requests, so I can see what you like, but know as you progress through the program and you get in those later rotations, you guys are going to have a higher preference for sites. And sometimes it's just because some hospitals only are good for floors and some are only good for ICU. And so if I need to send more of my NICU, go ahead.
I'm sorry. So technically you won't be at the same hospital all of your rotations.
Hopefully not. So
Okay.
The only time that has happened has been during COVID, when we had really limited sites.
Okay.
And we weren't able to send someone to multiple hospitals.
Okay.
So on your first rotation, it's long enough that I like to send you to 2 different hospitals, if at all possible.
Okay. Good to know. Thank you.
You're welcome. Are you guys excited about clinicals? I know it's really early in your program, but they're a lot of fun.
Makes me nervous, but it'll be cool.
You'll
once
be
we get
good.
I was
closer.
just about to say that I'm terrified, but I'm also really excited.
That's okay. I always got super nervous, even after my first rotation. I would get super, super nervous for every new hospital. And once you get that first day under your belt, you'll be okay.
I feel like if you're not nervous, you should great. It's like gross, like it's something new.
Say that again. Sorry, you broke up right in the middle.
Oh, I said if you're not nervous, I would be worried. Like it's just growth. It's something new, exciting.
Absolutely. Yeah. I get nervous on the students are like, I got this. I'm never scared of anything. It does make me nervous.
Like first day of school.
It is. It
Yeah.
is. New people, you're working in this whole new environment, especially if you've never been in the medical field and you're like, I don't know what to expect. Are they going to be nice to me? Am I going to remember everything? It's totally, those feelings are completely normal. Completely normal. I get nervous when I teach still. When I teach a new class, like the first day I taught you guys, it's like, oh my gosh, I don't know them. So it's totally normal. And then we come out to see you too. So you'll always have at least one, be seen one time by an instructor. So it can be me, Justin, Gina, Derek, or Mike, who's going to be our new instructor. So we come and see you. We're always available. If it's after office hours, just call me. If it's something that you get hurt or something happens, you can always call me or Justin. So we're here for you. We don't just push you out there to sink or swim. We're available. All right, any other questions for me? Thoughts, concerns?
Is the exam today, is that similar length to the one we had last week?
Yeah, I want to say it's 23 or 25 questions.
Okay. And it's just over the last two
Yep.
previous classes?
2 previous classes. So the majority of it is multiple choice, true, false.
It's like 50 minutes-ish again for like the timer on it.
Yeah.
Okay.
And open book. And then bug project due tonight. So you can submit those. And then I'm hoping to have everything graded. I do teach this afternoon, so I'm hoping to just get off and chip away at some more grading. So, all right. Well, I will let you guys go. Reach out with any questions that you have. I'm always here, even if I'm not teaching you. So,
Where is the exam posted? I don't see it. Under
did it
course
not pop up?
content. I
Okay,
just see day 4, and then there's no other day.
let me look
listed.
real quick.
Yeah, day 5 didn't.
Oh, son of a sucker. All right, let me, oh, wrong class. Let me open that one. That was supposed to, my bad, guys. I'm sorry. I apologize.
No, it's okay.
And I just sent you, well, like we emailed yesterday, I just submitted the link for the SharePoint for my
Perfect.
bug. Yeah.
And everything looked good. I looked through it. I just didn't have time to email you this morning. It looks good.
Okay. Thank you.
You're welcome. Okay, so day 5 should be available now. And let me check. Yep.
Yep, I
And
see it.
or this one's 30 minutes because it's shorter. The last one was longer. So it's 23 questions. All right. Well, I will let you guys go and let me know if you guys need anything.
Thank you so much.
Thank
You're
you.
welcome. Bye, guys.
Have a good weekend.
You too.
Thank you. Bye.
Have a good one.
Thank you.
Hey, Stacy, for the bug project, like if we are doing one slide that's a definition, do we need to then rewrite that definition in our speaker's notes?
No.
Or do we just leave the speaker's
You
notes
can,
blank?
if it's something like that, you can leave the speaker's note blank because it'd be hard to reword it and then just put it in the speaker notes. So if it's just a definition or something basic that you can't expand on in speaker notes, that's fine.